Hi, Dr. Powers. How are you?
Hi.
I just wanted to know if you can let some patients know what the procedure of the bioidentical pellet therapy is. What exactly do you do when we implement pellet therapy?
Sure. So typically, before you come in, if you're very interested in pellet therapy, we'll have you get some blood work done. And that's to assess your baseline hormones and also evaluate your thyroid as well to make sure that that's not coming into play with any symptoms that you're having. And once we have those blood work results, typically you and I will meet here in the office and we go through what symptoms you're having and what we can do for any of the specific symptoms you're having. And if you'd like to, then we can proceed with pellet placement after we've discussed all of the other options as well. But when we go for the pellet placement, you come into one of our exam rooms, which we keep very comfortable and private, and we have you lay down and eventually we'll go onto one side or the other because the pellet is going to be placed in your hip. So in order to see and expose the hip, we have you lay down and roll over to one side comfortably. And then we give you a little bit of lidocaine, numbing anesthesia medication. And after that, we're able to make a very, very small incision in your skin and guide the pellets underneath the skin, not deep, but underneath the skin directly, towards your either left or right hip. If you're happy with it, the next time you come, we go into the opposite hip and back and forth.
What are the benefits of doing pellet therapy versus creams? Is it more, is it more, what's the word I'm looking for?
Beneficial? Or?
No. Oh my God. Is it more? What are the benefits of doing pellet therapy compared to creams? Is it more convenient for the patient? Are you getting better outcomes from the patient?
Sure. So I think whether you're using bioidentical creams with our compounding pharmacists that we work with, or if you're doing pellets, plenty of women see great response with either. I would say the number one thing that's nice about the pellets comparatively is that it's one and done. So you don't need to think about it on a daily basis. You don't need to do any applications or treatments along the way. You just have the pellets placed, they work and gradually dissolve over time. And then you have another pellet placed in 4 months if you're happy with it. The beauty of pellets is that it's not something that you must do. It's not something that you have to have another treatment in order to take care of a certain ailment or anything along those lines. So if you're not thrilled with it, you just don't have to get it again. But in the meanwhile, the pellets that we do place over that 4-month period of time, they're dissolving and doing their work so that at the time they're due for another one, they've completely dissolved in your body. So it's not something staying in your body over time, since that's something that sometimes women are concerned about. I just wanted to mention that.
Thank you very much for the information.
You're welcome.